We've hosted two types of courses in the past. The orbital dissection course is different for our resident wet labs in that the goal here is not to practice surgery, but to focus on orbital anatomy and really learn orbital anatomy approaching the orbit from all different directions. In times before coronavirus, we would usually have our own residents, our fellows, and then also we would invite fellows from institutions all over the US to come and join us. And typically we'd have lectures and videos of pro-section demonstrations of orbital dissection on cadavers. And then this would be followed by actual dissections in the wet lab. The orbital fracture course, again, was a course that was open for our residents and also for our fellows, as well as fellows from other programs as well. Here the goal was to learn more about orbital fractures and then practice using different tools that are used in orbital fracture repairs. So we would have some reps from a few companies come. They would bring some of these plastic skulls that you could make fractures in, and then bring different screwdrivers and plates, and we could practice with those. And there were both lectures on how to repair orbital fractures as well as a lot of practice time.
I did the orbital dissection course when I was a junior resident. It was fantastic. I don't think I even appreciated just in my first year how great of an opportunity it really was. With having fellows from other institutions coming in, I was paired with an oculoplastics fellow from an outside institution and worked just one-on-one on a cadaver head and dissected through the tissues. The ciliary ganglion location is like permanently implanted in my brain now because of that session, and I will never forget where it is, whereas if I had just read it, I may not have it quite so imprinted in my mind. So I think it's an absolutely fantastic session and just another way to network as well. And in medical school, you do your anatomy lab and work on cadavers for a reason rather than just reading textbooks. So I think it really imprints the material for you.
This is a course that we invite the whole United States, all the first year retinal, visual retinal fellows, and they come, and the faculty consists of all the top visual retinal specialists in various programs. For example, we have Stanley Chang from Columbia, Don D'Amico from Cornell, Harry Flynn from Bascom Palmer. So we really we have top faculty, and each one comes and have like one or two lectures of their choice and giving students pearls of for example, I give pearls of scleral buckle, and they're just we just share all the fine tips, the things that we have learned throughout our career, and we try to share that with the incoming visual retinal fellows in 15-20 minutes. And then it's also followed by hands-on. So we have wet lab where the fellows all go into our surgical units, some of them depending what we are teaching. Also our surgical training lab is heavily used, and they learn how to place sutures, they learn how to start vitrectomy, and again, just all the fine tips that we really, teachers love to share that with our fellows. So it's nice that there are attendings from throughout the United States.
This is one of the highlights, of the year for us, as teaching faculty, and this is also open to residents all across the U.S. as well. We invite rising seniors to come join us for basically it's a full day Saturday and half a day on Sunday. So it's a intensive course, and I was fortunate that when I was a resident, I came and attended this course back in 2010, and still remember it, and really felt like, I mean, there are a number of these wet lab course opportunities that are available throughout the year, some of which are sponsored and so on. But I really felt like this course really set me up to start doing phaco. So it's a combination of didactic lectures on, basically covering every aspect of cataract surgery in detail, as well as some advanced topics, as well as some wet lab demos, and then of course the wet lab time hands-on sessions in small groups with one-on-one time for everyone. And so actually, as big as our wet lab is, it's obviously not big enough for everyone. This course is actually a like an all hospital endeavor, and we actually shut down the ORs, except for leaving one for emergencies. But we shut down the ORs and basically use them as wet lab stations, and that way we can have everyone rotate between stations, doing things like wounds and suturing, and obviously phacoing as well. It's basically a lot of faculty. It's a lot of preparation, but we prep the eyes for the residents so that the time that the residents are spending is purely learning time, and we really pack it in for a day and a half. It's also a nice little social event. We have a dinner. You can compare notes with your friends, and as you get into through your residency, these kinds of you'll see that these kinds of academic meetings are good opportunities to re-meet your colleagues and friends as well.